So what is dengue fever? Dengue fever is a virus that causes a high fever, headaches, nausea, a rash, and severe muscle and joint pain that has earned its nickname breakbone fever. If left untreated, it can cause severe dengue, which has the symptoms of abdominal pain, persistent vomiting, rapid breathing, and fatigue. This is due to fluid accumulation, respiratory distress, severe bleeding, and organ impairment, which could be fatal. There are 4 serotypes of dengue. Recovery from an infection of the virus will lead to lifelong immunity against that certain serotype, and if you are infected again by a different serotype, it increases your risk of developing severe dengue in the future. So how do you get dengue fever? Basically, the virus is transmitted by an infected mosquito, specifically the female mosquito Aedes aegypti. The symptoms take 4 to 10 days to appear and last for 2 to 7 days, typically. This mosquito is more likely to bite you outdoors and during the day. While a person is symptomatic, they can infect any new mosquitoes biting them, leading to an endless cycle of infection between people and the mosquito.
So how is dengue treated? Unfortunately, there's no specific treatment for dengue, but maintaining a person's body fluids throughout the course of the infection is vital. The initial mortality rate is around 20%, but after medical attention, that mortality rate drops to below 1%. So why should we worry about dengue? Dengue is very good at what it does. Before 1970, there were only 9 known countries affected by dengue. Today, that number has increased to over 100, and more than half of the world's population is at risk of infection. Additionally, the vector for dengue is native to most of the United States, including Arizona. During a single 4-month period in 2014, there were 93 travel cases of dengue infections reported in Arizona. All it takes is one infected person to be bitten by one mosquito for dengue to be on its way to becoming endemic in the States.
How do we prevent dengue? There is a partially effective vaccine for dengue available in other countries, but because it may cause complications with future infections with the virus, the vaccine is not recommended for people who have not previously had the disease. There is currently no vaccine for dengue available in the US, although there is ongoing research. For now, the most effective way of reducing the risk of getting dengue is to avoid being bitten by mosquitoes. One way to prevent mosquito bites is to wear insect repellent as well as shirts with long sleeves and pants when outside. Screens should be installed on windows and doors to stop bugs from getting inside. Another way of reducing dengue transmission is to control the mosquito population. Because the mosquitoes that carry the virus need to lay their eggs near water, the best way to reduce their numbers is to eliminate sources of water where they can reproduce. Aedes aegypti larvae grow in flower pot saucers, bird baths, tires, gutters, anywhere where there is standing water, so it is important to empty and clean any areas where water collects frequently.